A middle-aged female presents with painful hands. I'm showing you the radiograph of both hands. Describe the findings.
Okay. The radiograph of both hands demonstrates bilateral periarticular soft tissue swelling, most pronounced at the metacarpophalangeal and proximal interphalangeal joints. There is notable subluxation of several joints, including the metacarpophalangeal joint of the index finger and the first carpometacarpal joint. Degenerative changes, including mild joint space narrowing and sclerosis, are also noted at the wrists. Crucially, there are no marginal or central bony erosions. The combination of bilateral, symmetrical, deforming joint subluxation in the absence of bone erosions is highly suspicious for a collagen vascular disease, specifically systemic lupus erythematosus.
What is the differential diagnosis for a non-erosive, deforming arthropathy of the hands, and how do we distinguish them radiologically?
In that case, the differential diagnosis for a non-erosive deforming arthropathy includes systemic lupus erythematosus, Jaccoud's arthropathy, scleroderma, Ehlers-Danlos syndrome, and hypogammaglobulinemia. Systemic lupus erythematosus typically demonstrates reversible subluxations, ulnar deviation, and periarticular osteopenia without erosions. Jaccoud's arthropathy presents with similar ulnar deviation and subluxation at the metacarpophalangeal and first carpometacarpal joints following rheumatic fever, but also lacks bone erosions. Scleroderma and Ehlers-Danlos syndrome can be distinguished by the presence of prominent soft tissue calcification.
I am showing you comparison hand radiographs from two different patients. Describe the findings and identify the diagnoses.
Well, the first comparison radiograph shows severe bilateral metacarpophalangeal and first carpometacarpal joint subluxations producing ulnar deviation of the digits, but with a complete absence of joint space narrowing or marginal erosions, consistent with Jaccoud's arthropathy. The second comparison radiograph demonstrates florid, dense amorphous calcifications within the periarticular soft tissues of the hands and fingers, along with resorption of the distal tufts of the phalanges. This represents scleroderma, where soft tissue calcification, or calcinosis cutis, and acro-osteolysis are classic hallmarks.
Discuss the clinical significance of joint deformities in systemic lupus erythematosus and how they differ from rheumatoid arthritis.
Okay. The deforming arthropathy of systemic lupus erythematosus, often referred to as a Jaccoud's-like arthropathy, occurs in about 10% of lupus patients. The joint deformities are primarily caused by ligamentous laxity and joint capsule stretching, rather than direct cartilage destruction or synovitis. Therefore, these deformities are characteristically reducible or reversible in the early stages, unlike the fixed deformities of rheumatoid arthritis. Radiographically, the absolute absence of marginal bony erosions is the key feature that distinguishes systemic lupus erythematosus arthropathy from rheumatoid arthritis.
How would you manage this patient as a radiologist?
As a radiologist, I would recommend comparing these hand radiographs with prior exams to assess the stability and progression of the joint subluxations. I would recommend obtaining a baseline renal ultrasound to screen for medical renal disease or scarring, as lupus nephritis is a major cause of morbidity. I would also suggest a chest radiograph and echocardiography if the patient has cardiopulmonary symptoms, to evaluate for pleural effusions, pericardial effusions, or cardiomyopathy. I would communicate the deforming non-erosive arthropathy findings to the referring clinician and suggest a rheumatology referral for serological evaluation.